government preparing to enable hard drug use? Well, it would certainly seem so if the Liberals win the September 20th election. An expert task force on substance use created by Health Minister Patty Hajdu in March has weighed in this week, suggesting there no longer be criminal penalties for the possession and use of hard drugs. We're talking about drugs like heroin, cocaine, LSD, meth, and fentanyl. The task force claims that Canada's laws making the possession of hard drugs a criminal act has been part of an ongoing structural racism in this country, and that Canada's Black and Indigenous communities are unfairly and more often targeted with criminal charges for drug offenses. They also contend that substance use in the Indigenous community is a consequence of colonialism, and the never-ending drug war has caused irreparable harm to Black communities. The report comes up with no data to back up these claims, but this is not important to progressives in Canada these days, who use hurt feelings and oppression to justify the most ridiculous of contentions. In a statement, Ms. Hajdu says they must redouble efforts to save lives and meet the needs of people who use substances. Well, it's not surprising that the task force members, all of them academics or supporters of the trendy harm reduction philosophy that has gathered steam across Canada, would come up with further efforts to enable hardcore addicts. And it's just as unsurprising that Hajdu and her task force would use COVID as an excuse to further their enabling agenda, citing the increase in opioid deaths during the worst months of the pandemic last year. Well, never mind that loneliness, isolation, and the lack of mental health supports would drive people to do things they normally don't do. That's not mentioned at all. And I'm not sure how making hard drugs legal will change that. But here's the thing. Safe injection and harm reduction sites provide clean needles and a safe space for addicts to shoot up their drugs. In other words, they enable drug addicts to take their poisons, but safely. Rehab is most often either not in the mix or just an afterthought. And so the deaths from drug overdoses continue even at a faster rate despite the increase in safe injection and harm reduction policies. In Toronto, the number of safe injection sites has grown like weeds, along with the federal money given to host these sites. There are now 9 safe injection sites clustered around the downtown core, and 4 urgent public health needs sites in hotel shelters, all of them approved and funded by the Trudeau government. The fallout on the communities around these sites has been tremendous, with vandalism, break-and-enters, loitering, nudity, and assaults, including sexual assaults, rampant. One woman living right beside the Novotel shelter in Toronto's Esplanade neighborhood says without effective detox and rehab programs, the addicts are just enabled and propped up. She says decriminalizing hard drugs will increase drug trafficking and violence, which goes with the territory. It will also make the already increased crimes in areas way worse, she says, and lead to more violence. Health Minister Patty Hajdu claims that substance use is a health issue, not a moral or criminal one. Well, go tell that to the neighborhoods infiltrated with crime from the government's enabling policies. I have an idea. Let's call these proposed policies what they really are. If enacted, our politicians and the special interest groups will be killing addicts with kindness.